most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heining, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
So, as you might have gathered, today we're going to talk about how to stop low back pain with Dr. Stuart McGill's walking program. It's kind of nature's back balm.
And I know right away people have back pain. They say, my back bothers me. When I walk, it hurts. Well, we're going to show you a specific system that Dr. McGill has come up with so that you can get into walking and get that pain away and get you back to functioning again. So, Bob, are we going to
get into it?
Right on. So, now, this is really not meant for if you have sciatica. If you have pain down the leg, there is another modified walking program, which we're going to put up in the next week. So as a matter of fact, Thursday, we're going to film that one. So just hold on that one. But you can still learn some things from this because there's crossover. The first thing you want to do if you've got that lower back pain, we want to get into walking. First of all, we're going to plan on walking on a flat surface.
Gotcha.
No inclines, declines, or rough surfaces, bad terrain, anything like that. And you're just going to stand up with good posture. Go ahead, Bob. And Bob, you like to do this probably more so than I, but I think it's
just a kind of a check.
Yep.
I like to take my hand and grab the wrist on the opposite side.
Yep.
And pull back a little bit,
sure.
And it just straightens me out.
Right.
So I see a lot of people are a little bit flexed like this.
And you may not be aware of it.
Not aware of it. And this kind of jolts you back to reality.
Yeah. So
where you should be.
Yeah, kind of pull and feel the shoulders go back.
Right.
The idea is back pain is oftentimes from a slightly flexed forward posture that you're not aware of. So we want to get that and get the strain of our body weight and our trunk through that low
I've said
back.
this before, Brad, but I've seen some runners in our neighborhood that I just want to go stop them and get behind them and straighten out their back because they're like running like this.
Don't do that though, Bob.
I won't.
The next thing is once you get up tall and you feel like you have the back pain under control, it's like, oh yeah, and you may have to tilt your pelvis a little bit.
Yeah, one way or the other.
Yep. Find that most comfortable position, and then you want to tighten up your core muscles, so your abdominal muscles and around like your natural back belt, going to control that posture. Okay,
this can make a big difference. Like you might be in pain the entire time you walk,
right?
But if you tighten your abdomen just a little bit, sometimes it can take away the pain.
Exactly.
So
it's a combination: the proper posture position. That core tightening of the abdomen. And then at this point, don't just take off walking. Dr. McGill talks about just march in place, not like this, just knees up about halfway, shifting the weight right to left, and just kind of a test and see how that feels. If that's feeling good, still keeping that core tight, then we're going to start to walk. Now, we understand that your back may be bothering you and you may only get 5, maybe 10 steps and it starts to hurt. You stop.
Right.
Sit down, relax it, make sure you sit with good posture, of course, and then go back to it within an hour or so.
Right.
And repeat this. And the goal is go from that 5 to 10 steps to 10 to 15. And each day you'll find you're going a little bit further. And you're going to learn a little bit each time you work on
what position feels the best for your back.
Yeah. It's really a good way to understand your body positioning. You're going to learn that proprioceptive skills that we call in therapy very well.
Now, what happens over time is as you get more movement, you get more blood flow to the back.
Yep.
And it actually acts like a lubricant almost.
Sure.
Or nature's balm.
That's that term balm, which I don't like that term balm. It just sounds kind of weird to me. But I looked it up and it's accurate. So, I mean, Dr. McGill is right on. Oh, another important thing he does mention is swing the arms from the shoulder joint. So we're not walking, I'm exaggerating.
Like a robot.
Yeah. And of course, obviously, the right arm goes with the left leg. But if you think about that, you'll probably screw it up. So just walk normally.
Naturally.
So think about
swinging.
Yeah. And then a little bit brisker pace than a slow, you're not walking slow and testing it, be a little courageous there, arm swinging, and then pick up the speed a little bit, and that'll take the stress off the back slightly, and it can feel better actually with a little, I'm not talking power walking, we're just talking faster than that slow, cautious walk.
Well, yeah, and I found it interesting. I think Dr. McGill found it to be true is that, there's actually less weight on the back when you pick up the speed, the pace. And I tried this with a patient of mine. He came in limping terribly, and he did have sciatica, Brad.
Okay.
Actually, so this did work for him too.
Good.
And he came in. He looked like he had just been run over by a truck. And I started working just to work on walking to start
Yep.
off with. Went over some of these things, had him walk at a higher pace. By the end of the session, he was whipping his way around, and he had the biggest smile on his face,
Yeah.
like, "Wow!"
Yeah.
You know.
And I think that's what a lot of people can experience if you take your time with this.
Well, I think they're afraid they're going to hurt their back,
Right.
And generally, it's not going to hurt their back.
Right.
Generally, it's going to help your back, and it's really a good thing to do not only just once a day, but Dr. McGill recommends it 4 times a day.
Well, actually, on this program, you said once you get up to 30 minutes, walk 30 minutes 3 times a day.
Gotcha.
That's what he recommended. Again, take your time. Start out at 5 to 10 steps. It may take a few weeks, possibly, or hopefully it settles in much faster than that.
And 3 times a day, that coincides with meals. So, I mean, as a reminder, you can
Right.
do it after breakfast, lunch, and dinner.
Absolutely. And, you feel good about eating. You're kind of working things
That's
out.
right.
Things will move better.
Right. So, walking, one of the best things you can do. I know I had a friend, I've told this story many times. He worked at a back clinic. He was a physical therapist. That's the first thing they would do with back patients, get them walking.
Yeah.
By far. That was the number one thing they did.
I wonder how many patients were like, I came here to learn
Yeah,
how
I
to
know.
walk.
Exactly. This is what you
Yeah,
give me.
yeah.
Where's the modalities? Where's the exercise?
Yeah, aren't you gonna
do
put a
something
hot
to it,
pack on or
crack it or
Yeah.
something? But
No, sometimes the simplest things work the best. So carry on with your walking and be careful. Oh, the giveaway.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain free, and we upload every day.
Every day.
Also, go to bobandbrad.com. Go to the giveaway section. This week, we are giving away a mattress.
It's a doozy.
Oh, my gosh. Can you believe that? This is a Sleepovation mattress. 700 tiny mattresses with air channels. Keeps it nice and cool.
Does this sound like a commercial?
It's very comfortable.
It is.
I will vow.
Yeah.
Vouch for that.
And we really are, at the end of the week, we're going to give one away and they're going to ship it right to your house. If
Right.
you're the
And
recipient.
they have all the different sizes. And this is just a sample one and yours will come covered up.
Right.
So,
Yeah, as
anything
well.
else you want to say?
No, I'm very happy.
Check out our podcast, by the way.
And be careful with everything that you do.